Years old rugby player falls directly onto the shoulder. There is pain and swelling of the shoulder joint. The clavicle is prominent and there appears to the step deformity. What is the most likely diagnosis? So a 23 years old rugby player fall directly onto the shoulder joint. There is pain, swelling and clavicle is prominent near the shoulder joint. So first of all we have to see the shoulder joint and the relation of the clavicle in the shoulder joint. And here the answering option, the options are acromioclavicular joint dislocation, glenohumeral dislocation, sternoclavicular dislocation, supraspinatus tear, infraspinatus tear. First of all, let's see the shoulder joint and relation of the clavicle. This is the clavicle, and this clavicle, it is laterally connected to the acromion process by the different type of the ligament, and it also connected to the coracoid process of the scapula by different type of the ligament. So this picture, it is very clear. For prominent of the clavicle, what needing of this portion of the clavicle, it is detached from the lower part of the or the upper part of the scapula or lower part of the clavicle. So this ligament will have to cut for becoming the prominent of the clavicle. So there is a chance of tearing of this ligament, also chance of this ligament. Otherwise this clavicle prominent will not be possible. So it is the normal shoulder joint and normal relation of clavicle with shoulder joint. There is two important joint or two important connection by the ligament. One of the is in this area, that means the clavicle with the acromion process. Another one is the clavicle with the coracoid process. Here we can see this is the tearing of ligament, and it is the acromioclavicular joint dislocation. Here this area which is the acromion process, and there this is the coracoid process, and we can see the tearing of these two important ligament, and there the clavicle goes upward and it becomes visible. And here we can see this is the step deformity, that means the clavicle lateral end or acromial end, it is disconnected from the acromion process of the scapula. So let's see the acromioclavicular joint dislocation. Acromioclavicular joint dislocation normally occurs secondary to the direct injury to the superior aspect of the acromion process, and it is loss of the shoulder contour, that means the shoulder shape will be changed. Prominent clavicle are the key feature. So what is the key feature? The key feature is the prominent clavicle. And rotator cuff tear rarely occurs in this type of the injury, as there is a prominent clavicle, so the acromioclavicular joint dislocation occurs. So what is the answer? The answer is the acromioclavicular joint dislocation, because there is the pain and swelling in the shoulder joint, but there is clavicle is prominent, so it is the key feature for acromioclavicular joint dislocation. And there is the step deformity. So two important point, one is the clavicular prominency, second one is the step deformity, and among them the most important feature is the clavicle is prominent. So when there is clavicle is prominent, directly go for the acromioclavicular joint dislocation. Other option here such as the glenohumeral dislocation. Glenohumeral dislocation, in this condition the connection loss between the glenoid cavity and the humeral head. In this condition clavicle usually not prominent. And sternoclavicular joint dislocation, sternum it is located medially, it is not located to the scapula. Then supraspinatus tear, in case of supraspinatus tear usually there is no external fissure, only there is the abduction loss. Also the infraspinatus tear, it also responsible for shoulder joint movement, it is not related to the prominent